we've already talked about how the side effects of chemotherapy can be very diverse and can also vary from person to person in the other videos. One possible side effect that patients experience is mucositis. Excuse me, what? Well, that's the medical term for an inflammation of the mucous membranes. And in principle, such an inflammation can affect all the mucous membranes in the body, yes, from the oral cavity all the way to the rectum. Particularly common is the so-called stomatitis. Stomatitis is the medical term for an inflammation of the oral mucosa. It takes place, let me show you this here, in the mouth area. So basically, everywhere you feel moisture in your mouth, that's mucous membrane. Yes, and of course, mucous membranes are found in many parts of the body, but during chemotherapy, it's particularly typical for this area to be affected. So a stomatitis is basically an inflammation of the oral mucosa. With a mild inflammation of the oral mucosa, the mucous membrane is usually slightly reddened, maybe a bit sore, but without causing pain. In most cases, eating normally is still possible. However, if the inflammation worsens, the reddened areas in the mouth can start to hurt, and eating will likely become a bit more uncomfortable. And we'll get to that. Right now, though, you're probably wondering how these inflammations even occur and whether there's a way to avoid them or if they can somehow be prevented. So let us start at the beginning and go through it bit by bit. A mucositis occurs because the chemotherapy that you or your child is currently receiving or may receive soon also attacks the healthy mucosal cells, since they are also part of the fast-dividing tissues. The goal is to attack the rapidly dividing cells. Those are the cancer cells, but the cells of the mucous membranes also grow and divide quickly. So this, unfortunately, can lead to damage followed by inflammation, but it doesn't necessarily have to. Whether mucositis occurs and how severe it is depends, among other things, on the type of chemotherapy. But if it has affected you or your child, then of course there are a few tips that have already proven helpful for kids. So let's get started. We're going to keep it very practical. Keep brushing your teeth. First, if the mucous membrane in the mouth is swollen or even hurts, then you probably don't feel like brushing at all. I totally get that. But as you know, dental care is super important. If you use a soft toothbrush, like a baby toothbrush, really soft, then brushing is much more comfortable and doesn't hurt or irritate as much, right? Brushing 3 times a day after meals is sufficient. Secondly, rinse your mouth several times a day. The nurses have made good experiences with rinsing the mouth every 1 to 2 hours or 4 to 6 times a day using plain water, sugar-free tea, or special rinsing solutions from the clinic to keep it a bit moist, right? It's best to ask on the ward for a suitable liquid or solution, whatever works best for you. And very important, please do not use mouthwash from the supermarket or drugstore. These often contain alcohol or essential oils, which can further irritate the mucous membranes in the mouth. So third, eat a mild diet. Anything that is sour, fruity, spicy, salty, very hot, or very cold irritates the mucous membranes. You know, it adds to the irritation, though sometimes not necessarily. This also applies to anything particularly dry, hard, or crumbly. It's much better to go with soft, lukewarm food that isn't heavily seasoned. Yeah, so not too strongly spiced. For example, food with soft vegetables or a soup, right? It's important, though, not to stop eating if possible, just because you think it might be hurting too much. Don't forget, the body does need a lot of energy now. Energy is really important now, and of course nutrients too. They're especially urgently needed during your therapy and afterwards. So, if there are problems with drinking, then something as simple as a little straw can actually help. So that's a little trick that can really work very well. And then, of course, it's important to ask for help. It's totally okay to reach out to the nurses if you or your child is in pain. They can then work with you to consider and discuss which medications would help you or your child best right now. And they can also work with you to decide how long you can stay at home with the inflammation, for example. And when it's safer to say, now it's time to go to the hospital. And very important, please don't take any over-the-counter painkillers on your own at home, okay? Especially not if a fever occurs. So here, this could of course also be an electronic one. This is just symbolic, a thermometer. So remember, from 38 degrees Celsius and up, so temperature of 38 degrees, please make sure you head to the clinic so the treatment team can keep a close eye on everything. And fifth, inform the team about any changes. You know, it's important that the medical staff is always up to date on how you or your child are doing. And of course, that also applies to the mouth, right? So if you notice any more changes, for example, a sore spot, cold sores, white coatings, or anything like that, then it's best to inform a nurse right away. either in person or by phone. So they can take care of it and treat the affected areas. And now you're probably wondering how long it actually takes for the mucous membrane to recover. That varies a bit from person to person, and ultimately you have to wait until the mucous membrane regenerates. But it has been shown that it recovers as soon as the blood values improve. So as soon as the so-called ablation phase is over, the mucous membrane also begins to recover, right? If you want to learn more about ablation, you can also watch a separate video on that topic.